What satisfies me the most about where we are today is that now our elected officials are going to have to make decisions knowing how angry not only the Massachusetts public, but I think the American public is about the way this fiasco or debacle has played out over the past year. And so I was frightened that we got to this point. We almost got something. I'm delighted that a message has been issued to our elected officials that they better rethink this thing, and quickly.
The bills as they sit, with the access, with the insurance reforms, and with some incentives, both carrots and sticks, negative and positive incentives for hospitals, doctors, and the delivery system, I think are flawed. My sense is if the predictable combination of those bills are passed, I am absolutely convinced that 3 or 4 years down the road, draconian measures that would offset almost everything that is desired in this process would be the natural consequence.
When Democrats who were carrying the legislation begin to use the leverage to get favorable treatment for their states, if that had been 1 or 2 Republican votes, I wouldn't have felt as bad. But the party that has the majority, and they use the leverage in order to, and I think that's what ultimately alienated the electorate.
The unfortunate thing to me is that we may really get nothing. And health care in this country has some fundamental flaws. We've got 40 million people, 40 million people with no insurance. We've got sections of America with third world health care, primary care, and chronic care for that matter, go unserved in many communities. We've got a cost factor which was never really addressed in the reform discussions. It's literally out of control.
We need to change health care, and I think incrementally we can do it. What we really need to do are some of the payment reforms that would bundle care and make the people that deliver care coordinate it amongst themselves in a way that they have not been able to before, to a large extent because the existing federal regulations make it almost illegal sometimes to coordinate care.